Hi, welcome to The Best You, brought to you by Woodlands Online and Memorial Hermann the Woodlands Medical Center. My name is Shelli Whittecar, and today we get to visit with Dr. Nash. Thank you so much for joining us. Progressive pain and rehabilitation.
Thanks for having me.
Yeah, absolutely. So our conversation today is going to be about migraines, and from what I understand, June is actually National Migraine Month, correct?
That's correct.
Very good. So tell me a little bit. I know we all experience headaches, and some of us get bad headaches, and we wonder, is that a migraine? So what is the main difference between just our regular headache from tired or whatever factors to migraines?
So yeah, absolutely. With migraines, unfortunately, these patients, it's typically a chronic condition. They're going to often start in teens or the early years, and it has different features than like a headache that you might have from dehydration or exercise or a little bit too late of a night. So migraine sufferers often will have, not all of them, but a lot of them will have kind of a warning symptom that will come to them. They call this an aura. That could be some visual changes. They see some speckles of light, or they'll see some changes in colors, the way they're looking. They may have odd sense of smell. They may get a little bit nauseated, but that preceding aura kind of lets them know, oh, you better get to a quiet place where you can try to ideally lay down or relax, because then they'll go into the migraine headache, which is typically much more intense. It can be, usually it's one-sided, but it can involve both sides of the head. And it can be mild all the way to severely debilitating, to where patients are unable to work anymore because the pain is so severe they can't focus or concentrate or do the things they like to do.
All right. Well, good. So as you're starting to experience some of those triggers that you feel like this is coming on, what do you recommend people do?
So if possible, trying to avoid, a lot of folks will have some sensitivity to light, sensitivity to noise or sound. And so as best as possible, they can escape from their environment, and if they can lay down in a dark place and then just have it be quiet. And then if they have, seen a physician and they've already got a treatment plan, then there may be different kinds of medications they can use to try to quickly get the medication in and then avoid the kind of the full experience to minimize that migraine headache.
Okay. So what are some of those medications and treatments people can do?
Absolutely. So there's a lot of treatments. Unfortunately, migraine sufferers have had limited options in the past. There's a class of medications known as triptans, which can help reduce the migraine right away when they feel the symptoms coming on. They have some side effects. Some patients, they tolerate it well. Some patients don't do so well. Fortunately, there's a whole new class of medication that's come out, and it's available in both long-acting, it's an injectable once a month, and then they also have a whole new slew of medications for fast-acting. So you can have something to kind of manage it and reduce those symptoms in the long term, but if you still get a kind of a breakthrough migraine, you've got a new option to treat that.
Very nice. So you're talking about some preventative type things with injections, right?
That's right.
So that's interesting. How long has that been around?
So this new class of medications came out just this past 6 months or so.
Oh, wow. Good.
And so that's exciting. There's also on the preventative side, it's been approved by insurance and documented over years with research that Botox, which is of course well known for cosmetic reasons, but Botox has been shown to treat a variety of medical conditions, including migraines. And so when folks have kind of a typical area they may have somewhere in the side of the head or the back of the head, you can treat that with Botox, and that tends to reduce the intensity and the frequency of those headaches.
Okay, so that's even if you're doing Botox like towards on your face.
Some patients do have a lot of frontal migraines, and so that's where they feel a lot of the pain and the throbbing and sharp pain, and so we'll treat that muscle called the frontalis, and they'll look a little younger up there. Nice
benefit.
Nice little benefit there. Yeah,
that's good. So anything else that we should know about migraines, and I guess maybe when should we be concerned and see our doctor that is happening?
Yeah, absolutely. If you experience a headache that's kind of outside the range of headaches you've had before, or you've got some vision changes, or you feel nauseated, or you have other symptoms in the rest of your body, it's worth going to see a physician and just investigating that, make sure there's nothing else going on, look a little deeper. And then some folks have intermittent migraines and they just kind of deal with it. It might be worth getting back to your neurologist or pain physician or whoever your doctor is, just to see about these new options, because there may be a better way to manage it.
Okay, good. And about how many people are affected by migraines every year? Is there any statistics that you can share with us?
There are, depending on the range, because there's such a spectrum, but there are definitely millions of sufferers. And so a smaller percentage of that will have the severe, more than 50% of the month, they're having severe daily headaches. But that percentage is significant. And, and then the folks that they know that they're going to lose 1 or 2 days every week because they're less productive and the headache's going to kind of take them out of commission. There's much more of those folks. Okay,
wow. So you guys offer those treatments here?
That's right.
Okay, very good. So you guys feel free to reach out to Dr. Nash at Progressive Pain and Rehabilitation. They'd be glad to help you out. And thank you so much for joining us on The Best You. Thank you for your time today.
Absolutely. Thank you so much.
Yes, have a great day.